secondary contradictions that we have among us and really build a national front and do the right thing.
Well, among those at the donor conference yesterday was Dr. Paul Farmer, well-known activist, medical anthropologist. He was appointed the UN Deputy Special Envoy for Haiti, working under former President Bill Clinton. He's the founder of the charity Partners in Health, which provides health care for people with HIV, AIDS, tuberculosis, and malaria and other conditions in Haiti, as well as 8 other countries. He's vocally criticized U.S. destabilization efforts in Haiti, as well as major U.S. corporations that have pursued profit at the expense of global health. Well, on Wednesday, Democracy Now! Producers Aaron Mate and Nicole Salazar caught up with Dr. Farmer at the conference.
The biggest problem, as was predicted by many, the biggest problem is shelter. So right after the earthquake, and we were there. I was, thinking as a doctor might, what these people, we needed trauma care, orthopedics, all kinds of medical care, as you might imagine, for injury. We needed relief and rescue efforts, and you needed food, water, and shelter. I'm not suggesting the food and water problems have been solved. They haven't. But the biggest problem is shelter. You have people living in these very precarious circumstances, as you know, and if it's dry, there are fire risks, and if it's wet, there are flooding or erosion risks. So that's what we really have to act on very urgently, is trying to help people have better shelter. That's the #1 problem right now. Now, what I would say to an American audience, or anybody, any thoughtful, progressive, forward-thinking person, is what have we not done so well in Haiti in the past? How have our policies been flawed? How have the attempts to fill this space? You have a flawed policy. Say, for example, you're looking at support for a dictatorship. The United States had a relationship with the Duvalier dictatorships for a long time. And you're saying, wait, we don't want to do that. Part of the reaction to that was to only put money into non-state actors like NGOs and certain contractors. Has that had the results that we wanted? No. Otherwise, Haiti would not be both the country with the highest per capita rate of NGOs in this half of the world and also the least literate. So again, I keep going back to this very difficult struggle about if we believe in the right to health care, if we believe in the right to education, who confers rights? Not NGOs. The United States can't confer rights in Haiti. The Haitian government has to confer rights, right? At least the right to education, the right to health care. I would also say the right to clean water. Any social and economic rights usually delivered by the government, as it was in the United States. When during the Great Depression, you had brisk engagement from the federal government, and I'm sure state governments as well, to try and respond to unemployment, a lack of housing, a lack of health care, such as it was, a lack of public infrastructure, and that was a good thing for the United States, to have that kind of brisk intervention. Now, Haiti does not have the public coffers that even in the lowest point of the Depression, Haiti's in a much worse situation than we were back then, even. But that doesn't mean that the Friends of Haiti, if there are any, can't say, we'd like to see some of these resources go to building back public health and public education, or building back better, as President Clinton keeps saying. I think it's a good term. I don't like slogans very much, but build back better suggests that Haitians do have something to build on, and I would say that Haitians have the Haitian Revolution to build on. That's a pretty glorious past in so many ways. They followed through on what other people were talking about: liberty, equality, fraternity. They banned slavery, and they were the first to do it. And Haitians believe, as you know, that they're being punished for. They were punished for that for 2 centuries, for ending slavery.
You've been involved in Haiti for many years. What's it been like for you to witness the country in the aftermath of the earthquake, personally?
Well, this is not something I like talking about very much, and I think you can understand that for those of us who have been working there a long time and are familiar with the places and have roots there, it's been very difficult. It would have been difficult had it happened in any place that I didn't know. But to have it happen in the place where we've all been working or living, was it being the loss of so many lives and so many buildings and especially houses is very, very painful, and it is still painful. And I'm headed back there, and I know that there's going to be some of the rubble gets cleared out little by little, but it still looks like there's just been an earthquake there, and it will look that way for a while because rebuilding after such a colossal catastrophe is going to take many, many years. Anybody who tells you today or any other day that they know what they're talking about or dealing with, whether emotionally, logistically, in terms of financial planning, rebuilding, can't be telling the truth, because nothing like this has ever happened in the middle of a capital city. Maybe Managua in 1972, but that was, this is many times worse than the other natural disasters that people talk about. So it's been personally very, very difficult, and I think just the sights and smells and sounds of it have been difficult. And that said, the Haitian people are very heroic. I don't want to romanticize heroism that is, or their resilience, but I have to say they have been able to pull themselves together, and better than any other people I could think of. And they have a long, hard slog in front of them. We know that just by visiting one of the camps, the temporary settlements, but they ought to at least be able to count this time on having real accompaniment as they go forward in that long, hard slog.
Paul Farmer is the UN Deputy Secretary, the UN Deputy Special Envoy for Haiti. He is the founder of the charity Partners in Health, which is very active in Haiti, as well as a number of other countries around the world. This is Democracy Now!, democracynow.org.